Hey everyone, and welcome to another deep dive. Today we're focusing on helping our nursing students out there.
Yeah, really drilling down into pulmonary infections and conditions.
Exactly. We'll be working from your nursing school textbooks and articles and trying to,
Give you more practical.
more practical look at these
And
conditions.
just imagine yourself, you're
Yeah.
in your clinical rotation.
Yeah.
A patient comes in with this horrible cough that just won't quit.
Oh,
Shortness of breath. What do you do?
right.
Well, that's what we're here for.
Let's break it down. We'll be covering the whole gamut
Absolutely.
from acute tracheobronchitis to,
The different types of pneumonia. We'll talk
Yeah.
about COVID-19 and its effects.
right, and some of the rarer things.
Yeah, some of the rare ones like lung abscesses and sarcoidosis. And of course,
Tuberculosis.
TB. We can't forget about TB,
And we'll even touch on pleural issues.
like pleurisy,
Yeah, that stabbing chest pain.
which can be so painful for patients.
And even acute respiratory failure. Those.
Real emergencies
Yeah, the real scary stuff.
where you have to think fast.
Exactly. So by the end of this deep dive, you'll be well equipped to assess, manage, and care for patients with these conditions. Sound good?
Sounds good to me.
All right, let's start with something pretty common. What about acute tracheobronchitis?
Okay, so acute tracheobronchitis.
This is essentially
Think of it as a chest cold.
like a super chest cold.
Yeah, that decided to go to the gym and get really intense.
Okay, so we're talking about
That's it.
the trachea and the bronchine, the airways that lead down to the lungs.
Right.
And it's usually
Usually it's viruses that are the main troublemakers.
Right.
But bacteria, they can also jump into the mix and complicate things.
they love to join the party.
They love a good party.
So as nurses,
This is very...
you're listening for that
Oh,
cough.
that cough.
That's the
It
hallmark.
might start out dry and annoying, but then it can turn into this productive cough
The productive cough.
with the colorful mucus.
Right.
We've all seen it.
The textbooks don't hold back on the details.
Absolutely not.
So how can we tell if a patient with this super intense chest cold has it progressed to something more serious?
That's a great question, and it's something you're going to encounter all the time in practice.
All the time.
Listen carefully for wheezing
Oh.
or even stridor. That high-pitched sound,
Oh, yeah.
that can signal a possible airway obstruction.
Oh.
And that's when you know things are getting a bit
Dicey.
dicey.
Exactly. So wheezing stridor, we need to
Red flag.
red flags.
Yeah.
Okay, so let's say we have a patient with acute tracheobronchitis. How do we help them breathe easier?
Well, if it's a bacterial infection,
Antibiotics.
antibiotics are usually the go-to.
Right.
But if it's viral, it's all about managing those symptoms.
Okay.
Think pain relievers,
Right.
plenty of fluids to thin out that mucus,
Right.
and maybe even some soothing, cool mist therapy.
Okay, so what about us as nurses? What can we do to really go above and beyond for these patients?
I'd say encouraging rest is huge.
Of course.
Their bodies are working overtime trying to fight off this infection. We also want to focus on what we call bronchial hygiene,
Okay.
teaching them how to cough effectively,
Right.
get all that gunk out. And consider using tools like an incentive spirometer to help those lungs expand properly.
Yeah, I remember those barometers from SimLab. They're such simple tools.
They are simple.
But they make a big difference.
They really do.
Okay, so let's move on to another big one. Pneumonia.
Oh, pneumonia. It comes in so many varieties.
More varieties than a coffee shop menu.
It really does.
And our sources really stress the importance of figuring out where the patient picked up the infection.
That's a big clue.
Yeah, so we have community-acquired pneumonia, CK,
The most common one,
often caused by bacteria, like,
Streptococcus pneumonia.
but then there's healthcare-associated pneumonia, HCK.
That develops after a patient has had some recent exposure to healthcare
Okay.
and tends to involve those tougher, more resistant bacteria.
Ah, the fun ones.
The fun ones, exactly.
And then we have hospital-acquired pneumonia, HAP,
Right.
and ventilator-associated pneumonia, VAP.
Those sound even more
Comfortable,
complicated.
so,
They,
okay,
they sound scarier.
They can be,
Just
especially because HAP and VAP often involve those superbugs
Right.
that don't respond easily to treatment.
Nuts that just don't want to go away.
Exactly. And we can't forget about our patients with weakened immune systems.
Right.
They're vulnerable to what we call opportunistic infections
Okay.
that wouldn't usually cause pneumonia in healthy people.
So lots to remember about the different types of pneumonia.
Oh, yeah.
But regardless of the type, are there any telltale signs that it's pneumonia?
Well, that cough is back.
That nagging cough.
That nagging cough. But this time it often comes with fever chills
Oh.
and even chest pain that gets worse with every breath.
Oof, that sounds miserable.
It can be.
The materials also mention dyspnea and tachypnea.
Right, the patient is fighting for each breath, so their breathing becomes...
Rapid and shallow, and when you listen to their lungs,
Yeah.
you might hear crackles.
Crackles.
Those sounds like Rice Krispies.
I remember that.
That's a key sign of fluid buildup in the alveoli,
Right.
those tiny air sacs.
This is where our nursing assessment skills really come in.
Absolutely. We're like detectives piecing together the clues.
Love that analogy. Okay, so speaking of piecing things together, let's talk about COVID-19.
Okay.
It's been the elephant in the room for the past few years,
It has.
and it's changed so much about how we approach respiratory care.
So true. COVID-19,
It can trigger this.
a really aggressive form of viral pneumonia.
Right.
It attacks the lungs,
And
sets off this massive inflammatory response.
And in really severe cases,
It can lead to a dangerous cytokine storm.
a cytokine storm. What does that even mean?
It's basically the immune system going into overdrive,
Oh, no.
causing widespread inflammation and damage.
And that can lead to...
Severe lung damage, and even acute respiratory distress syndrome, ARDS.
And that's when things get really critical, right?
Absolutely. Patients might need supplemental oxygen or even mechanical ventilation
To help them breathe.
to help them breathe.
So for all of our nursing students out there,
Yes.
what's the main takeaway when it comes to COVID-19 and its impact on the lungs?
I'd say mastering the art of respiratory assessment is crucial.
Okay.
That means consistently monitoring oxygen saturation levels,
So,
listening attentively to lung sounds,
got it.
and being super aware of any signs of respiratory distress. Early detection
Can save lives.
can truly save lives.
Okay, moving on. Let's talk about aspiration pneumonia,
Aspiration pneumonia, this one is so important for nurses,
especially.
those who work with older adults or patients with swallowing difficulties.
So this is basically when something
Or food or liquid
takes a wrong
goes
turn.
down the wrong pipe
It ends up in the lungs,
instead of the stomach,
and that triggers inflammation.
and often a bacterial infection. So think about patients who've had a stroke or have conditions like Parkinson's disease.
Right.
They might have trouble swallowing, which makes them more susceptible to aspiration.
So as nurses,
Our interventions are key here.
yeah, elevating the head of the bed, especially after meals,
So important.
seems so simple,
It is.
but it can make a big difference.
It can. And paying close attention to their swallowing,
Right.
collaborating with a speech therapist,
Of course.
and maintaining excellent oral care are all critical.
It's all about teamwork and using all the tools in our nursing toolbox.
It really is.
Okay, now let's switch gears to a condition that has been around for a long time,
A long time.
but is still a serious threat.
A serious threat?
Tuberculosis or TB.
TB. It's a bacterial infection.
Caused by...
Mycobacterium tuberculosis.
And it really loves...
It loves the lungs.
It sets up shop in the lungs.
It does.
And it
It's
forms
up to
these
more.
little pockets of inflammation.
Right.
And TB can be really sneaky. A person can be infected but not have any symptoms for years.
That's what makes it so challenging.
Right, but then eventually those classic symptoms might emerge.
They might.
That persistent cough.
Sometimes with blood.
Sometimes with blood. Chest pain, weight loss.
Oh, yeah.
Drenching night sweats. Fatigue, the whole 9 yards.
The whole shebang.
The whole shebang.
So early detection is key here.
It is.
What about testing?
The Man-2 tuberculin skin test.
Also known as?
The PPE test is a good starting point.
Okay.
It checks for exposure to the bacteria.
And if it's positive,
If it's positive, we need to do further testing to confirm an active infection.
and if it is active TB.
Treatment can be lengthy and complex.
Right.
We're talking about a multi-drug regimen
Okay.
that patients have to take for several months.
For months.
Months. And adherence is crucial.
Absolutely.
Nurses play such a vital role in educating patients about the importance of completing the full course of treatment.
Even if they start feeling better before the course is finished,
Because skipping doses...
can lead to drug resistance,
Right.
which makes TB much harder to treat.
Much harder.
And remember, TB spreads through the air.
Oh, yeah.
So infection control is paramount.
Paramount.
Think N95 masks, proper ventilation,
Got it.
and teaching patients good cough etiquette.
Cover your mouth.
Cover your mouth and nose when you cough.
Okay, future nurses, we're on a roll. Let's tackle another challenging condition.
Okay.
Lung abscesses.
Lung abscesses.
A lung abscess is basically
It's a localized collection of pus within the lung tissue.
a pocket of infection.
Imagine it as a pocket of infection that's just taken hold.
Ew.
It often happens as a complication of bacterial pneumonia,
Especially...
especially aspiration pneumonia.
So let's say a patient has had pneumonia, but it hasn't completely cleared up.
Okay.
They might have this cough
A cough.
that's producing foul-smelling sputum,
Yes.
along with chest pain and fever,
You're painting a vivid picture. No, it's good. It's important.
and treating a lung abscess.
Often involves a long course of intravenous antibiotics,
Intravenous antibiotics.
sometimes for weeks.
Weeks, and in severe cases, a procedure to drain the abscess might be necessary.
So again, early detection and treatment are key here.
Absolutely.
Okay, let's move on to a condition that's a bit of a medical enigma.
Okay.
Sarcoidosis.
Sarcoidosis.
It's a chronic inflammatory disease
Yes.
that can affect multiple organs.
But the lungs are often the primary target.
And the weird thing about sarcoidosis is
We still don't know exactly what causes it.
it's a mystery.
It's a mystery. It seems like the immune system overreacts,
Okay,
leading to the formation of granulomas
those granulomas again.
in various tissues.
So a patient might present with,
Shortness of breath,
okay,
a persistent cough, maybe some fatigue and weight loss.
yeah. And the tricky part is,
The symptoms can be really subtle.
oh no,
They can even mimic other conditions.
making it hard to diagnose. Which makes diagnosing sarcoidosis a real challenge.
Time to put those detective hats back on.
Absolutely.
And treatment often involves
Corticosteroids
to reduce inflammation.
to reduce inflammation. But sometimes
Right.
we need to use other immunosuppressive medications.
Okay, and again,
Patient education.
patient education is so important.
So important. We need to help them understand their medications and how to manage potential side effects.
Right.
Speaking of side effects,
Oh.
let's move on to some conditions that affect the pleura,
The pleura.
that double-layered membrane that surrounds the lungs.
Right.
We're talking about pleurisy and pleural effusion.
Okay, so pleurisy, also called pleuritis.
Right.
Is
That's
basically-
inflammation of the pleura.
What does that look like in a patient?
Well, imagine those two layers of the pleura rubbing against each other with every breath.
Ouch.
It causes this sharp stabbing pain,
I can imagine.
especially when they inhale deeply.
I winced just thinking about it.
The causes can range from infections to autoimmune disorders to even lung cancer.
Wow.
So pleurisy is really a symptom,
More of a symptom.
not a disease in itself.
It's a clue.
It's a clue that points to something else.
Right. Okay, now pleural effusion.
Pleural effusion is different.
Tell me about it.
This is when fluid builds up in the pleural space.
So instead of those two layers of the pleura gliding smoothly,
Right.
there's this fluid compressing the lung, making it harder to breathe.
Exactly.
And the symptoms.
Can be similar to pleurisy,
Right.
shortness of breath and chest pain,
Right.
but sometimes it's more subtle,
Oh, no.
which can make it hard to detect.
So what do we do when we suspect pleural effusion?
A thoracentesis
Thoracentesis.
can provide both relief and answers.
What is that?
It's a procedure where a needle is inserted to drain the fluid.
Okay.
It helps us figure out what's causing the effusion,
Right.
and it also eases the pressure on the lungs,
So they can breathe easier.
making it easier for them to breathe.
Okay, and then depending on the cause.
The treatment might involve antibiotics, diuretics, or even more specialized therapies.
Okay, buckle up, everyone, because we're about to discuss
A scary one.
a really scary condition.
Acute respiratory failure, or ARF.
ARF.
This is basically when
The lungs just can't do their job anymore?
they can't deliver enough oxygen into the blood or remove carbon dioxide effectively.
A true medical emergency.
A true emergency, it can happen quickly,
And the causes.
are numerous. From severe pneumonia to exacerbations of COPD
Right.
to even pulmonary embolism.
So picture this. You walk into a patient's room, and they're struggling to breathe.
Okay, I'm picturing it.
Their breaths are rapid and shallow.
Oh,
Their lips and fingertips might be turning blue
that's not good.
because of the lack of oxygen.
A lack of oxygen.
And they're using all those accessory muscles in their neck and shoulders
Trying to get air.
just to try to breathe.
What do?
What do?
We act fast.
We've got to move.
First, we get them oxygen. But in severe cases,
I may need.
they may need mechanical ventilation to support their breathing.
And this is where our nursing skills,
Really come into play.
this is where we shine.
We need to constantly assess their respiratory status,
Constantly.
adjust those oxygen levels, manage the ventilator settings,
Okay.
and watch for any signs of complications like a pneumothorax,
A collapsed lung.
a collapsed lung. It's a high-stakes situation.
High stakes.
And your knowledge and quick thinking can make all the difference.
Wow. Okay, future nurses, we've covered a lot of ground today, but there's so much more to explore.
So much more.
Stay tuned for part 2,
I'll be here.
where we'll go even deeper into those nursing interventions and patient education strategies for all of these complex pulmonary conditions.
It's going to be great.
It's going to be fantastic. See you then.
See you then.
Welcome back, everyone. Last time we explored all sorts of pulmonary conditions, from those super chest colds to the complexities of pneumonia and beyond.
And all those other fun
All
things.
those other fun things.
Mm.
But now,
Now let's shift gears.
yeah, let's shift gears and talk about what you as future nurses can actually do to help these patients.
Okay, so it's one thing to recognize those signs and symptoms,
Right.
but it's another thing entirely to know how to intervene effectively,
It's about taking action.
taking action. And that's what we're going to focus on today.
Love it. So let's revisit pneumonia care.
Okay.
Remember, this is an inflammatory process
That is
that affects those tiny air sacs in the lungs,
the alveoli.
alveoli.
Yeah.
And that inflammation can be caused by
Bacteria, viruses, and even fungi.
so many things.
It really makes those alveoli's job
Of exchanging oxygen, carbon dioxide,
so much harder.
much harder. And that's where we come in
That's where the nurses come in.
with our nursing interventions.
Our goal is to support those struggling lungs
Right.
and help patients recover as quickly as possible.
I remember the textbooks really hammering home the importance of oxygen therapy
Yeah, oxygen there.
as a cornerstone of pneumonia care.
And for good reason.
Why is that?
Ensuring adequate oxygen saturation is absolutely vital.
It's like the most important thing.
It really is one of the most important things.
And you'll all become pros
Yeah, you will.
at using those pulse oximeters,
Those pulse oxes.
aiming to keep those SpO2 levels.
Right within that target range.
Exactly. And sometimes it's not just about giving oxygen.
Sometimes it's not.
It's about helping patients use their lungs
Efficiently.
more efficiently. So that's where,
Deep breathing exercises and incentive spirometry come in.
oh, the spirometers. You remember those from SimLab?
I do remember those. It felt a little silly at first.
It did.
All that slow, deep breathing, trying to get that little ball to rise.
Yeah, I remember that.
But it makes so much sense now.
It really does. Those deep breaths, they help to expand the lungs and prevent atelectasis.
Atelectasis. That's when
It's just when those tiny air sacs collapse.
we don't want that.
No, we want to keep them open and working.
Keep those alveoli happy.
Happy alveoli.
And don't forget about positioning.
Something as simple as elevating the head of the bed
Right.
can make a big difference
It can.
in lung expansion.
It can. And for patients with a lot of mucus buildup,
Oh, yeah.
chest physiotherapy can be a game changer.
Remind me what chest physiotherapy is all about.
Oh, yeah. So it's not just giving them a back rub.
No back rubs.
No, no back rubs. We're talking about techniques like percussion and vibration,
Okay.
which help to loosen up those secretions
Right.
and make it easier for the patient to cough them up.
Yeah.
It might not be the most glamorous part of nursing,
Right.
but it's incredibly effective.
Yeah.
I remember one patient who had been struggling with thick mucus for days.
Oh, no.
And after just one session of chest PT, he was able to cough up a huge amount of phlegm,
Oh, wow.
and his breathing improved dramatically.
Really?
It was like night and day.
That's amazing. It's amazing how such hands-on techniques can make such a difference.
They really can.
And speaking of hands-on, we can't forget about one of the simplest but most important interventions.
Which is
hydration.
hydration. Oh my gosh, so true.
Encouraging fluid intake
Yes,
helps thin those secretions.
it does.
Makes them easier to clean.
easier to clear.
And of course,
Staying hydrated.
it's just crucial for overall healing.
Absolutely.
Okay, so we talked about supporting breathing
Yes.
and clearing those airways.
Yes.
But what about those other symptoms that come with pneumonia?
Like,
Like fever and pain?
yeah.
How do we manage those?
Well, you'll likely be administering antipyretics,
Antipyretics.
like acetaminophen or ibuprofen,
to bring those temperatures down.
to bring those temps down. And pain management is crucial as well.
It is.
Pneumonia can cause some significant chest discomfort,
Right, especially when taking deep breaths.
especially with those deep breaths.
So those same NSAIDs can help with pain control.
They can.
And I remember learning about non-pharmacological approaches too,
Oh, yeah.
like positioning and relaxation techniques.
Sometimes just helping a patient get into a more comfortable position can make a world of difference.
It can,
It really can.
and let's not forget about the emotional aspect of care.
The emotional aspect.
Pneumonia can be really scary for patients.
It can.
They might be anxious about their breathing,
Of course.
worried about missing work,
Yeah.
or just feeling plain miserable.
Just feeling awful.
It's our job to provide reassurance,
Reassurance.
answer their questions, and advocate for their needs.
Advocate for their needs.
That holistic approach.
Holistic nursing care. We're not just treating the disease,
We're caring for the whole person.
the whole person. And remember, clear communication is essential.
Communication is key.
Explain those procedures.
Right.
Like chest physiotherapy in a way that puts them at ease.
Makes them feel comfortable.
A little bit of empathy
Empathy goes a long way.
goes a long way.
Now let's turn our attention to aspiration pneumonia.
Aspiration pneumonia.
We know this is a big concern for patients with swallowing difficulties.
It is.
So what are some things we can do to help prevent aspiration?
Well, prevention is key.
Prevention is key.
We need to be extra vigilant with patients who have dysphagia.
Dysphagia, which is the medical term for
Difficulty swallowing.
difficulties swallowing.
So if a patient have a history of stroke, Parkinson's disease,
Uh-huh.
or any other condition that affects swallowing, we need to be on high alert.
Absolutely. What are some practical things we can do?
Practical things. Let's see. I remember learning about thickened liquids.
Thickened liquids.
Thickened liquids are a great example.
What are those?
So it might seem strange,
Okay.
but those thicker consistencies can be much safer for patients who struggle with swallowing.
Okay.
They give more control and reduce the chance of those liquids going down the wrong pipe.
I see.
The textbooks often have these helpful charts
Mm-hmm.
showing the different levels of thickness,
Okay.
from nectar-like to honey-like to even pudding-like.
It's a whole new world of beverages.
It is.
And let's not forget about oral hygiene.
Oral hygiene.
I imagine that plays a role in preventing aspiration pneumonia as well.
It's absolutely crucial.
It is.
Poor oral hygiene can increase the risk of bacteria getting into the lungs,
Right.
which can lead to infection.
So we're talking.
Regular toothbrushing, flossing,
Got it.
and maybe even using those special mouthwashes.
Okay.
And for patients who can't manage their own oral care,
We need to step in.
we need to step in and provide that assistance.
It's all part of providing that comprehensive care.
It is.
Now, shifting gears again, let's talk about TB care.
Okay, TB care.
We know that TB treatment is a marathon, not a sprint,
Marathon.
with those medications needing to be taken for several months.
Months.
What can we do to help patients stay on track?
Well, our role as nurses is multifaceted.
Multifaceted.
We're educators, cheerleaders, and advocates all rolled into one.
It's a lot of hats.
It is a lot of hats.
Yep.
We need to explain the importance of taking those medications exactly as prescribed,
Okay.
even when they start feeling better.
Because they might feel better,
They might.
but they still need to keep taking the meds.
Absolutely. We also need to be aware of potential side effects. Right.
And monitor for them closely.
And because TB is contagious,
It is.
we need to be sticklers for infection control.
Spicklers.
So teaching patients about cough etiquette,
Cough etiquette.
covering their mouth and nose when they cough,
Yes.
and depending on the setting, they might need to wear a mask
they might.
to prevent spreading the bacteria.
Exactly. We're protecting both the patient and those around them.
Everyone.
Everyone.
Now let's turn our attention to lung abscesses,
Lung abscesses
which, as we discussed,
are often a complication of pneumonia.
what are some key things to keep in mind when caring for these patients?
Key things to keep in mind.
So imagine a patient who's had pneumonia but isn't getting better.
Okay, I'm imagining.
They might have a lingering cough
Uh-huh.
that's producing foul-smelling sputum
Yeah.
along with fever and chest pain.
Right.
That's a red flag.
Red flag. Something else might be going on.
And in addition to those intravenous antibiotics,
Right.
we need to think about drainage.
Drainage.
That pus needs to get out. It does.
So sometimes we can use postural drainage
Postural drainage.
and chest physiotherapy to help move those secretions.
Right.
But in some cases, a more invasive procedure might be necessary, like
Ah.
percutaneous drainage.
Okay.
Or even surgery.
It really depends on the individual case.
It does.
We need to assess those patients carefully,
Right.
looking for signs of improvement or deterioration.
Improvement or deterioration.
And we can't forget about nutritional support.
Nutritional support.
These patients are fighting a serious infection.
They need their strength.
They need all the fuel they can get.
So encourage a high-protein diet
High protein.
and maybe offer small, frequent meals.
Small, frequent meals.
If they're not feeling up to those big meals,
Right.
it's all about tailoring our care to their individual needs.
Exactly.
Now let's talk about sarcoidosis.
Okay, sarcoidosis.
This is the one that's a bit of a mystery.
a bit of a mystery.
The cause is unknown,
Unknown.
but it involves the immune system
Going haywire.
going haywire and forming those granulomas,
Granulomic.
various organs,
Often starting with the lungs.
often starting with the lungs. So what are some key nursing considerations for these patients?
Well, first and foremost,
Yeah.
we need to remember that sarcoidosis can affect multiple organs,
Not just the lungs.
not just the lung. So we need to be asking those questions,
Okay.
doing those assessments,
Uh-huh.
looking for any signs of problems beyond the respiratory system.
It's like being a detective again.
We are detectives. We're piecing together all the clues.
Right. And another key consideration,
Yeah.
medication management.
Medication management.
Treatment often involves corticosteroids,
Corticosteroids.
which can have a whole range of side effects.
They can.
So it's essential to educate patients
Educate.
about those potential side effects, like weight gain,
Weight gain.
mood swings,
Mood swings.
and an increased risk of infections.
Infections. We want them to be informed.
Informed.
And know what to watch out for.
Absolutely. Knowledge is power.
Knowledge is power.
And we want to empower our patients
Empower our patients.
to be active participants in their care.
Active participants.
Now let's shift our focus to pleurisy and pleural effusion.
Okay.
Remember, pleurisy is the inflammation of the pleura, that membrane that surrounds the lungs,
surrounds the lungs.
and it can cause intense chest pain,
Intense chest pain.
especially with breathing.
Especially with breathing.
And pleural effusion
Pleural effusion.
is the buildup of fluid in that pleural space,
Right.
which can compress the lung,
Compress the lung.
making it hard to breathe.
Making it hard to breathe. So what are some key nursing interventions for these conditions?
Well, for pleurisy, pain management is the top priority.
Pain management.
We can use analgesics like NSAIDs and encourage positioning that minimizes pain,
Right.
such as lying on the affected side.
Sometimes simple comfort measures can make a huge difference.
They can.
They really can.
And for pleural effusion,
Pleural effusion.
the focus is often on draining that excess fluid.
Draining that fluid.
We talked about thoracentesis earlier.
Thoracentesis.
That can be both diagnostic and therapeutic.
It can.
It helps us figure out what's causing the effusion
Right.
and also provides relief by removing the fluid,
Removing that fluid.
making it easier for the patient to breathe.
Right.
And after the procedure,
After the procedure.
we need to monitor closely for any complications like
Pneumothorax.
a pneumothorax.
A collapsed lung.
We want to make sure that lung is happy
Happy lungs.
and expanding properly.
Okay, let's move on to our final act.
The final act.
Acute respiratory failure, or ARF.
Air.
This is a true medical emergency.
It is.
And as nurses, we need to be ready to act quickly and decisively.
Quickly and decisively.
Remember, ARF is when the lungs...
Can't effectively deliver oxygen to the blood or remove carbon dioxide.
Right. Leading to...
A buildup of CO2 and a drop in oxygen levels.
It's life-threatening.
It is life-threatening. So let's say we walk into a patient's room
Okay.
and we see them struggling to breathe.
Okay.
Their breathing is rapid and shallow.
Rapid and shallow.
They might be using those accessory muscles in their neck and shoulders.
Right.
And their skin might have a bluish tinge
A bluish tinge.
because of the lack of oxygen.
Lack of oxygen. What do we do?
We need to act fast.
Act fast.
Oxygen therapy is our first line of defense.
Oxygen.
We want to get that oxygen into their system as quickly as possible.
As quickly as possible.
But in severe cases,
they
might need mechanical ventilation
mechanical ventilation
to support their breathing.
to support their breathing. And this is where your nursing skills are truly put to the test.
It sounds intense.
It can be intense. What are some of the key things we need to be doing when caring for a patient on a ventilator?
So many things. We need to be constantly assessing their respiratory status,
Assessing.
monitoring those vital signs,
Vital signs.
checking their oxygen saturation levels,
Oxygen saturation.
and being hyper-aware of any changes in their condition.
Any changes.
We might be adjusting oxygen levels, managing ventilator settings,
Ventilator settings.
suctioning their airways,
Suction.
and administering medications as ordered.
It's a multifaceted
It is.
and demanding role.
And it's not just about the technical aspects of care, is it?
It's not.
We also need to provide emotional support
Emotional support
to the patient and their family.
to the patient and their family.
Being on a ventilator can be a terrifying experience,
It can.
and they need reassurance
Reassurance.
and clear communication.
Clear communication. You're absolutely right.
We're not just caring for their physical needs.
We're not.
We're caring for their emotional well-being as well.
Absolutely. A calm and supportive presence can make a huge difference.
It can.
It really can. Now let's talk about preventing complications in ARF.
Okay, preventing complications.
One of the biggest risks for patients on mechanical ventilation is ventilator-associated pneumonia,
VAP.
VAP.
So infection control
Infection control
is paramount.
is paramount.
You need to be meticulous about hand hygiene.
Hand hygiene.
Maintain a sterile technique when suctioning,
Sterile technique.
and keep the head of the bed elevated.
Head of the bed elevated.
All those things we've talked about.
All those things. You got it. Every little detail matters.
Every little detail matters.
And we also need to be aware of other potential complications, like barotrauma, which is lung damage caused by high pressure from the ventilator.
So we're constantly monitoring those ventilator settings.
Monitoring those settings.
Making adjustments as needed.
It's all about finding that delicate balance between providing enough support without causing harm. And of course, if the ARF is caused by an underlying condition, like pneumonia or a pulmonary embolism,
we need to address that underlying cause. But we're working collaboratively with the medical team.
Collaborating.
Administering medication. Monitoring for any signs of improvement or deterioration. Exactly. It's a team effort.
It is a team effort.
And communication is key. We need to keep everyone informed. And work together to provide the best possible care. For these patients.
Okay, future nurses, we've covered a lot of ground today.
We have.
But we're not quite done yet.
Not done yet.
There's still more to explore. In this deep dive into pulmonary conditions.
So stay tuned. For part 3. Where we'll discuss even more advanced nursing interventions. And delve into those ethical considerations. That can arise in respiratory care.
It's going to be good.
It's going to be fantastic. We'll see you then.
See you then.
All right, future nurses, welcome back. We are in the home stretch now of our deep dives into pulmonary infections and conditions.
We've come a long way.
We've tackled recognizing those tricky conditions and mastering the essential nursing interventions.
You've done a lot.
But now
it's time to level up those skills. Let's level up and explore some of the more advanced aspects of respiratory care.
The really advanced stuff.
Especially those you'll encounter in critical care settings.
So the ICU, the ER.
Exactly.
Okay, I'm ready.
So let's dive into the world of mechanical ventilation. A life-saving intervention for those with severe respiratory failure.
I remember feeling intimidated by ventilators in SimLab.
Oh, yeah.
There were so many buttons and settings. What are some of the key things nurses need to know about managing patients on mechanical ventilation?
Okay, so it is a complex skill.
It is.
But with practice and a solid understanding of the principles, you'll become confident in no time.
Okay, that's reassuring.
It is.
So imagine you're in the ICU.
Okay, I'm imagining.
Caring for a patient who's intubated and connected to a ventilator.
Okay, got it.
What are your priorities?
So many priorities.
So many.
What are the most important things?
Well, first and foremost, we need to make sure the patient is breathing properly.
Okay, breathing properly. So that means
monitoring their respiratory rate, their depth, their rhythm.
Okay.
Making sure their oxygen saturation levels are within the target range.
Right.
And I remember learning about arterial blood gas tests.
ABGs.
Which give us a
detailed snapshot
of their oxygenation and ventilation.
That's a great start.
Okay.
Now let's talk about the ventilator itself.
The ventilator. This is the scary part.
It can be scary, but it's also amazing.
Okay.
It has so many settings that we can adjust.
I know. So many settings.
To really fine-tune the patient's breathing support.
Okay, so like the fraction of inspired oxygen, or FiO2. Which determines how much oxygen they're getting with each breath.
And the tidal volume.
Which controls how much air is delivered with each breath.
Right, and then there's PEEP, positive, and expiratory pressure, which helps keep those alveoli from collapsing.
Right. Keeps those tiny air sacs open.
Open and happy.
Happy alveoli. So adjusting these settings.
It's like a delicate dance. You need to find that sweet spot. Where you're providing enough support without overdoing it.
And causing damage.
So
what are some of the potential complications we need to be watching for?
Okay, so complications of mechanical ventilation. One of the big ones is ventilator-associated pneumonia. VAP. It's an infection that can develop when bacteria enter the lungs through the breathing tube.
So infection control.
Infection control is absolutely critical. We're talking about strict hand hygiene, maintaining a sterile technique when suctioning the airway and keeping the head of the bed elevated.
To prevent those secretions
from pooling in the lungs.
And then there's barotrauma. Lung damage caused by high pressure from the ventilator.
Right. And we also need to be on the lookout for pneumothorax.
A collapsed lung. That can happen.
If the pressure from the ventilator is too high.
Right. So we're constantly assessing and reassessing. Looking for any subtle changes.
In
the patient's condition.
And it's not just about the technical stuff.
It's not.
No. We also need to think about the patient's comfort and psychological well-being.
That's so important.
It is. Imagine being intubated, unable to speak or communicate easily.
It must be terrifying.
It's a very scary situation.
So how can we make them feel more at ease?
That's where your compassion and communication skills really shine.
Compassion and communication.
Because even if they can't speak, there are ways to communicate.
There are.
Yes, we can use whiteboards, picture cards, or even eye blinks.
Eye blinks.
Eye blinks.
Wow.
To help them express their needs.
It's about being present, listening attentively, and providing reassurance.
Exactly. Sometimes a gentle touch or a calming voice can make a world of difference.
I love that.
Yeah.
And speaking of making a difference, let's talk about the ethical considerations.
The ethical considerations
That can come up in respiratory care.
Yeah, these can be some of the most challenging situations we face as nurses.
It can be tough.
One of the biggest ethical dilemmas, deciding when to initiate or withdraw mechanical ventilation.
That's a heavy decision.
It is a heavy decision.
What are some of the factors we have to consider?
We have to weigh the potential benefits of treatment against the burdens.
Benefits versus burdens.
We need to consider the patient's wishes, their overall prognosis, and their quality of life.
And sometimes those wishes might not be clearly documented.
Right, or the patient might not be able to communicate them.
So it's essential to involve the family.
Absolutely.
In these discussions.
And the healthcare team.
And sometimes we might even need to consult an ethics committee.
Yes, an ethics committee can be very helpful in these complex situations.
It's about working together, respecting the patient's autonomy, and providing care that aligns with their values and goals.
Absolutely.
Wow, we've covered so much ground in this deep dive.
We really have.
From those early days in nursing school, learning about the respiratory system, to mastering essential nursing interventions and grappling with ethical dilemmas.
It's been quite a journey.
What are some final words of wisdom you have for our aspiring nurses out there?
Never stop learning.
Never stop learning.
Stay curious, ask questions, advocate for your patients.
Oh, great advice.
And remember, every breath matters.
Every breath matters.
You have the power to make a profound difference in the lives of those struggling to breathe.
That's beautiful and so true.
Thank you for having me on the show.
Thank you for being here. It's been a pleasure. And to all our future nurses out there, keep those stethoscopes handy. Stay compassionate and never underestimate the impact you can have. We'll catch you on the next deep dive.